Welcome to the Killer Boobies podcast, Unraveling Breast Implant Illness. Here's your hosts, Wendy Bunnell, Leslie Smoot, and Brandy Vega.
Our guest today is Dr. Ryan Spivak. He is a plastic surgeon from Los Angeles, California, and his office is called Sculpt Body Shaping. I just need to tell you, the most unique thing about his practice is that they are a silicone-free zone, which is the most remarkable and probably the first in the US. But we're so excited to have you. I looked online and I saw this slogan that you have, and I got so happy about it because it says beautiful breasts with no ugly side effects. Hallelujah.
Yes.
This
Yes.
is so important. Thanks for joining us today.
It's my pleasure. You know, again, I'm Dr. Spivak from Sculpt Body Shaping in Los Angeles. I'm so excited to be a part of this, to, you know, be a resource to women, to be a support network for women, and to do things the right way. It'd be great.
Yeah, so your facility, your office focuses on breast implant removal or the explant surgery, and you also help women create volume by doing fat transfers if they want to do that, both post explant surgery or if they've never had an implant and they want to have some volume, right? And so this body
Correct.
contouring is really a great alternative for women, again, who want volume, but they don't want to have these side effects. I'd love to hear what you have to say about silicone and why you're a silicone-free zone.
Okay, so that's what our practice is all about. You know, we're a silicone-free zone. That's our mantra. You know, Sculpt was started by myself and my partner, Dr. Daniel Suissa. We've been operating along this mantra of ours for years now. At the end of the day, we just really believe that implants are bad for women. They cause damage, there's a ton of side effects. And what we tried to do with our practice, and which we successfully did, was create alternatives for women outside of the traditional industrial silicone implant marketplace. And so for that reason, you know, and we're laser focused. We're all about, you know, body contouring procedures, explantation for women, getting rid of, you know, these horrible things, right? This does not exist in my practice. This is like a paperweight for me now, okay? Total paperweight. So we're all about getting rid of those. And we're all about helping women fix damage from implants, have a safe provider that understands breast implant illness, understands the differences in capsulectomy types and all those different options, and also has an option that's all natural that can fix implant related problems for women. As well, we're also an alternative for women that don't want to do silicone implants, but still want to go through with the breast augmentation. So that is like our laser focus. We're passionate about it. We're committed about it. And that's what kind of gets us up and excited every morning. So
The thing that is really one of the biggest burning questions that a lot of women have in the breast implant groups is, what about fat transfer? Is that an option? So since that's one of the things that you specialize in, let's just dive into that topic today. And would you please explain to us, what is a fat transfer? How does it work? And what is the outcome that women have? Just take us on a journey so that we understand.
Okay. So your question, what is a fat transfer and how does it work? Okay, so in its most simple element, it's literally removing fat from one area of the body and transferring it to another area. So it involves, you know, part of the procedure involves liposuction because you actually have to remove it. The second part of the procedure involves processing the fat, filtering it, concentrating it, keeping it healthy and safe, and then transferring it back to an area of need. And in the podcast today, we're going to be talking about, obviously, fat transfer to the breast. So in its most simple form, that's what it is.
There's a fear of, you know, I've been through so much, I'm not sure I want to do something else to my body. And people don't know if this has been around for a while and if it's been studied, and they're not quite sure what the experience has been in the world of plastic surgery with fat transfer. So maybe you could tell us a little bit about the history of fat transfer.
Okay, great. So I'm going to create two parallel universes that developed at exactly the same time. There is the implant universe, and then there's the fat transfer universe, a better way. I wish I had something besides my hand, but okay. So the 1960s, right? Doctors started experimenting, taking fat from one area of the body and grafting it. You use a syringe. You put in little amounts of fat into an area of the body. And, you know, taking a step back, a fat transfer, you put these little amounts of fat in little quantities to a specific area of the body, and your body grows a new blood supply into it, retains it, and makes it permanent. So doctors in the 1960s were using fat transfer for scars, for indents, for patients with burn injuries. And so they started doing a little bit at a time. Well, let's put a little bit of fat in this scar and figure out how that works. And they realized that if they did it with the proper technique where they were gentle with the fat, did small amounts from multiple different directions to kind of build and layer things up, they could get a successful result. So this is like in the background and is starting up. But then at the same exact time, Dr. Cronin invented this in the 1960s. And so all of a sudden you have this off-the-shelf product that gets you that instantaneous result. And so in these two parallel universes, the market exploded for breast implants. And by the 70s and 80s, you had Dow Corning and all the, you know, the companies making implants. They were the most popular thing. There couldn't be anything possibly wrong with it. And that market blew up. The fat transfer market kind of dwindled, right? Like it was used for burns and scars and little things.
Right.
But then the 1980s hit and doctors started using fat transfer more for women for breast reconstruction. And what they would do is women had mastectomies, they had implants in, sure, but they had maybe tight skin or scarring from radiation, from the removal of the breast. And so doctors started doing that fat transfer procedure to the breast to soften things up, to improve the quality of the skin, to make it look more real, and also to help soften up scar tissue. It also helped a lot with pain. It wasn't as painful anymore. And so that was the 80s. And then that also developed in the 90s. But it really wasn't until the 2000s that doctors started to experiment using fat for higher volumes, right? So they were transferring it to women's bottoms or the breast. And that's where it's really started to expand from there. Now we've entered, you know, 2010s, right? And now you hit 2015, and finally women are starting to get together on social media and talk about breast implant illness. So now, thank God, these are going to be on the way out. But at the same time, doctors such as myself and my partner, Dr. Suisa, who got this new training, we're new doctors. We got this training in the 2000s. So at this point in time, Dr. Suisa and I have been doing this for 4 to 5 years. We've done this for probably almost 1,000 women. We're a practice that only does this. We don't do facelifts. We don't do Botox. We don't do, you know, X, Y, and Z.
Oh, great.
This is all we're focused on.
Expert in this category.
Yeah, and we do it over and over again. So we've sort of become a center of excellence, right? We've gotten the technique down. We know exactly how to make it predictable and reliable and super safe. So I think at this era that we're thankfully in, with implants going on the way out, we finally have a real solution and doctors that have gotten this down pat. So you will see on the internet a Google review that says, oh, the fat didn't take, or, oh my gosh, I tried it. But you know what? If you went to a doctor that does that once every 3 months and maybe once or twice a year, you can pay anybody to give it their best shot.
Right.
But I do this multiple times a week. That's a huge difference.
Yeah, I think anytime you go to a plastic surgeon, you want to find out what the area of expertise is. And that's why we have you on here, because this is your area of expertise, so you get to speak to it.
Taking it to step back to your original question, what is a fat transfer? We can do this procedure now. You can do it awake. We use it, you know, at Sculpt Body Shaping or Sculpt. You know, we have a technique that Dr. Suisa and I, that's proprietary, called soft sculpt. We use super miniaturized instruments for liposuction that are really gentle on you. You can remove fat from any area of excess in the body that you want to look great in anyway. Mm-hmm. You can remove that fat, filter it, process it, and gently transfer it to your breast.
Could I just suggest it might be in the lower back area or in the thighs, on the hips, this kind of area? Because this is where women tend to carry it, maybe even in the belly.
Totally. So those are some of the most common areas for women, especially, you know, the tummy area, the love handles or the waist and hips, the lower back, your upper back area, your legs. Honestly, anywhere that you have, you know, a pinchable area or a, you know, a little something extra, you can do it. You can also do it it can also be done for women that have a really low BMI or are really skinny. You just have to take a little bit from multiple areas. And you can do the whole procedure awake.
Yeah, that blows me away. Okay, let me tell you why it blows me away on a couple levels. I've had
Okay.
liposuction and I got my implants 12 years ago. I did liposuction on my hips, and I'll tell you, the implant surgery was less painful than the liposuction surgery. That was 12 years ago. So
Right.
the first big question I have for you is the liposuction painful? And
The
is
answer,
that recovery hard? Are they going to be bruised, you know?
so you had traditional liposuction the old school way. Huge instruments that rip and scrape the fat out of your body. It hurts like heck. You have to do it under general
Yeah.
anesthesia. It's brutal and the recovery is horrible. But with this, you can do it awake. It's super gentle on you. You will be in no pain throughout the procedure. You'll be entirely comfortable. We use a special mixture of numbing medications. And the instruments are really gentle on you and really gentle on your fat, right? So the fat is protected and kept healthy. You're not brutalizing it as you're ripping it out of the body. Our process, soft sculpt, it spins really, you know, it spins, it vibrates really gently, and it sort of creates a symphonic hum that vibrates the fat out or plucks it like a grape off of the vine. So it treats it gently and your body gently. And so you're looking at a recovery of 3 to 4 days where you're super sore, but no pain, and you can get back to work quickly. So I feel like this is that perfect area where we've found that modern solution where you don't have to have general anesthesia. You don't have to have the scary risks that come with it. You can get back to work in 3 or 4 days. You can avoid silicone implants and you can fix problems from it without having all the downsides.
It kind of blows the mind because we're used to thinking of these kinds of things done under anesthesia. But we also know that going under anesthesia is really hard on the body. And so if you can get a procedure done without having to be under anesthesia, better for you, better for everybody.
Oh, amazing. Absolutely.
Let's show everyone a video clip of the fat transfer procedure from your office. Here we go.
We're going to start by harvesting fat. The fat is filtered, processed, washed, and we add an antibiotic into it. How does it feel once the numbing is in? Pretty?
It's okay, yeah.
Now you're going to be good. Numbing is in. Basically, this is an awake, natural breast augmentation. All natural, no silicone.
Yeah, so everything we've done in our practice is to make it easy and to get the risks to be minimal to none.
Would you just share with us what some of the risks are with fat transfer?
Like any procedure, there's always a risk. I think the main thing for this is a risk of infection, right? You know, you're taking fat from one area of the body, you're transferring it to another area of the body. It has to take, a new blood supply has to grow in. Okay, Dr. Suisse and I, we've done this, like I said, 1,000 times, thousands of times of the areas of the body. We've never had a single infection. And I think that this relates to a few things. One, you're not under general anesthesia, which puts you at a higher risk because it suppresses your immune system, your dead weight on the operating room table. It's been shown to increase the risks. Two, we're not traumatizing your body. It's gentle, right? When there's a lot of trauma and inflammation, it increases your risk of infection. And three, we're doing everything through very small holes and incisions about the size of a tip of a pen. We actually leave those little holes open to drain a little bit, which happens the first 24 hours. A little bit of fluid leaks out. And you want that to leak out. You want all that fluid and numbing fluid to leak out, which helps flush your system of any bacteria. When you don't have fluid pockets building up in your body, bacteria can't grow into it. And so the risks with the way we've set it up, gentle on you, very small little holes that are made to do every part from the liposuction to the fat transfer. It's so atraumatic, and it prevents any buildup of abnormal fluid that bacteria can grow in. It really so significantly reduces the risk. Now, there is always a risk, but if you were to get an infection, at that point it's treatable. Sometimes you have to drain it, extra antibiotics, but it's not something that's going to put your health at a major risk. And we've never even had one.
Wow, that's really great.
So
That's
I think
really
it should be, yeah, no procedure comes without risks, but I think that should be very reassuring to women that we've found a way to do this to mitigate those risks as much as possible.
Right, right. And when you put those little holes all over the breast for the fat transfer, do they leave marks, or does that just heal over afterwards?
So it leaves a mark about as big as a freckle. And that freckle kind of fades out over, it takes about a year, but it does fade out over about a year's time. Again, you compare that to a big scar for getting an implant placed, a big cut for a drain coming out of your body for a lift or things like that. And so this is, I would say the only people who would notice it would be the people who know you had it done and were specifically looking for it. So I would notice it, you would notice it, but anyone else would just think it's like a freckle or a skin blemish.
Mm-hmm. Yeah, that's great. Listen, I have to ask a question for the young ladies that are involved in this group, because I know there's some girls that have had breast implants in their late teens or 20s who are now getting them removed. They're still having babies. So if they get a fat transfer, would this impact their ability to breastfeed or anything like that?
Great question. Will it impact your ability to breastfeed? Definitely not. It has zero impact. You're adding fat in where there's fat to the breast, your own natural tissue. It doesn't affect your breast gland, and it doesn't affect breastfeeding. So big thumbs up.
Let's just take a scenario here. Let's say someone like me had implants and had them removed. And let's just say the outcome was, let's say I was flat at the top section of my breast and wished I had a little fullness. So how is that going to look after getting a fat transfer?
Okay, amazing question. So a silicone implant, as we all know, creates a look that looks like a big round orb.
Yep.
Big, round, and full.
Yep.
A fat transfer definitely looks different. It takes your natural breast shape and it enhances it. So it's a look that's natural, it's elegant. It's your breast but larger, it's your breast but more enhanced, it's your breast with fuller, thicker, and rejuvenated skin. So if you had your implants removed, and let's say you really need to fill in the upper areas because the skin got stretched out, or you have scar tissue, or you have some lumps or dents maybe around this area or on the sides, those are areas that we can specifically target with the fat transfer. It's really nice because you can target different needs, right? If you just need overall fullness, we can do that. If you need overall fullness, but a little bit more on the top or the cleavage area, you can do that. If there's specific areas with scar tissue that needs to be softened up and improved, you can do that. The whole thing is rejuvenative. That's the best part about it. And it gives you a natural breast that's elegant and enhanced.
That's nice. Now, I know that when I've looked at people that have had fat transfers, they talk about maybe needing to go in for follow-up procedures. What's been your experience with that?
So a fat transfer ultimately is permanent. So this isn't like Botox or fillers where you go in like every 4 months or 6 months for your refresh or update. So it's definitely a permanent lasting solution. Now, that said, we do have a small subset of women who want to do it twice. What would be the reasons for that? That would be if you just simply want them bigger and fuller, right? And so I've had women where maybe we did the first stage where we took fat from the abdomen, the waist, hips, the love handles, transferred to the breast. We waited 6 months. They were thrilled. They're like, you know what, doc? I love it so much. Let's up the ante. Not many women, but there are definitely some that want that. And so maybe we would come back and take some from the thighs or the legs and do a second round. There's also another subset of women. There are women that have humongous implants placed,
Yeah,
for their breast augmentation.
right.
There are some women where the skin is so stretched out that they desire a second round, right?
Mhm.
And that's because the skin is so stretched out that you do have to do it a second time. And that's mostly a personal decision. It's like, how far do you want to take it, right? You've done one fat transfer. Yes, your skin is stretched. Yes, you look way better. So do you want to take it up another notch or not? That's definitely an option. And so I'd say those two categories are the main ones.
Okay. So if someone was talking with you about a fat transfer, can they go up a breast size or a cup size, or is it a more subtle increase?
So from our experience, you can definitely at least go up a cup size, if not more. Again, it depends on your body type, the shape of your breast, if how much you have to use, how much ammo you have, right? So if you're an A, you can go to a B. If you're a B, you can go to a C, and on and on.
How about if a woman gains weight after this procedure or loses weight after the procedure? Does it affect that fat transfer?
So if you gain weight, your breasts will get fuller. And if you lose weight, they'll get less full, right? But we've made a new shape and a new proportion. And so body weight will normally fluctuate like your normal breasts. So if you pick up a little bit, it'll change in that new proportion. And if you lose a little bit, it'll change in that new proportion. But the fat always stays.
Okay, so it sounds like it's pretty stable tissue. We have a lot of women in the audience that are bodybuilders. So if they're
Right.
doing work, if they're doing a lot of workouts, would that affect the fat transfer?
So we always say that you should give your workouts a chill for at least 4 weeks after the procedure, because that'll allow, you don't want to be burning fat while you're trying to give it the opportunity to take and retain in your body.
Yeah.
So we always say to everybody, give it about 4 weeks, 5 weeks to kind of chill. You can do light hiking, walking, light exercise, but nothing where you're really burning. And that gives the fat an opportunity to take and to stay permanent.
Okay, and lifting weights and doing chest and shoulder exercises wouldn't impact the new fat transfer?
No, not at all. So after about 4 to 6 weeks, you're good to go.
Well,
You can exercise, you can get back to a normal routine.
yeah. So how long is the procedure when you are in your office having the work done? How long does it usually take to do the breast?
So on average, about 3.5 hours. Some women it's around 3, some women it's around 4. And that kind of depends on how many areas you're removing fat from.
Okay, let's talk about the anesthesia then, because you're not under anesthesia during this procedure. What sort of things are you doing to stop the pain then?
Okay, cool. So we say that this is done awake. You get a shot of pain medication. We give you Xanax to help relax you. And then we use laughing gas as well, kind of like at the dentist's office. Okay, so at that point, we put on some music.
Yeah,
Everyone gets to pick their own, right? You can have your friend, family member kind of stay in and watch if you want. If you don't have to do that. We have funny, ridiculous conversations, right?
you
and
must
you're
have
feeling
the
really good.
craziest conversations.
Oh yeah, it's great. If you have like a significant other and you don't want them to learn any secrets, maybe keep them out of the room, because they can definitely get a lot of info out of you. But no, so in all honesty, you're feeling really good. We use 2 different numbing agents, a special formula that we developed that is short acting and long acting. And we do all the numbing right in the beginning. Any area we're working on, it's all numbed up right from the beginning. So literally once that's in, the entire rest of the procedure is pain-free. You're going to feel the vibration from, the soft sculpt instruments that I talked to you about.
Mm-hmm.
You'll feel vibration, but not pain. And it's really great because I can turn and position our patients on the back, the left side, the right side. Let's go in the tummy. Let's check for symmetry. We have to make sure it's blended right. And that's what gets those amazing results, because it can be blended, it can be smoothed properly, and I can really turn and position you. Whereas when you're under general anesthesia, you just can't do that.
Mhm.
So you're taking this from like horrible pain, general anesthesia, super scary, to like actually a really good experience, you know? Very positive. You bond with your surgeon. You're stuck with me for a few hours. Not so bad. We've had jokes. You get to really get to know people. It's actually really nice. There's a bond for sure.
Yeah, I've heard that from some of your patients that they just adore you. So I think that's awesome.
Oh,
So
that's sweet.
when the patient leaves, what would they expect, and what's that recovery like?
Okay, great question. So you are super sore afterwards. Imagine it's New Year's Eve. Okay, you just made your New Year's resolutions and you're like, darn it, I'm going to hit the gym. I'm going to do this, I'm going to do that. And the next day it's January 2nd, January 3rd, and you do like a Pilates class, a yoga, you do some weightlifting and a little, you know what, I'm going to take it to another level. I'm going to do some running on the treadmill. And then you wake up the next morning and you're really sore. So it's just like a really hard workout at the gym.
Okay.
The cool part is I haven't written narcotics for my patients for years. All we use afterwards is ibuprofen, Tylenol. Some patients on their own will use CBD oil, maybe for the first couple of nights, just to help take the edge off, but it's really not bad, just very sore. For women that work at home and have, they're working the next day. They can do phone calls, teleconference, follow up on emails for their business or for the company that they work for or the group they work with. That's really great. And you're up and walking the next day. I always recommend, take a walk outside, stay up, stay active.
The whole time we're talking about this, in the back of my mind, I'm thinking it's easier and it's safer. You don't have a silicone implant in your body when you're done. You don't have to worry about the autoimmune problems. So have you ever experienced a woman getting any nerve damage after this sort of procedure?
Definitely not, which is really nice. When you make cuts on the breast, you're lifting up muscles, it's when it's very invasive like that, there's definitely risks. You can have numbness from your nipples, you can lose feeling to the nipple area. That has never happened with this procedure because again, you're adding something in that rejuvenates the breast. It makes it healthier. It's the exact opposite of silicone implants. So good news. The answer is no.
So if a woman is going into you to have explant surgery and you also do fat transfer, is this something you can do during the same afternoon or the same morning?
A lot of women want to have it all done at once, right? Like I'm coming in, I'm getting my explant. Like I don't want to have to keep flying back and forth for a fat transfer later. Let me have it done all at once. In those cases, for whatever reasons, you need to get back to work. You don't have time to come back 3 months later. It gets really complicated and more expensive, as far as traveling. Then you can definitely do it at once. I think the results are about 80% as good as doing it in 2 stages. But for a lot of women, that's perfect for them. They don't expect a perfect result. You can get it done in 1 stage. You're one and done, fabulous. For some women that are local in our area, we almost recommend, let's just take the implants out, let you heal, let everything settle down. Let's give it a good amount of time to just get better from breast implant illness, get your life together, get your energy back, get healthy, right? Then you could always come back 3 months or any time period beyond that to transfer fat in as a second stage. Obviously, you have a little bit more space to work with when you do it in 2 stages, right? Because when you take an implant out, there's an empty space. But when you do it 3 months later, there's a little bit more space to fill up. So that's why the results are a little bit better doing it in 2 stages versus 1 stage. But I think that myself and Dr. Suisa were really good at helping kind of guide women through that decision-making process. And honestly, there's no wrong decision you can make with that.
Yeah, I just think it's so important for a woman to sit down and talk with her plastic surgeon and find out what's right for her, especially the women who have had breast implant illness. They want to take it easy.
And you know what? To me, that's oftentimes the best decision, right? Hey, listen, these things are making you sick. Let's not overcomplicate. Let's just get them out. Let's get you better. And when you're feeling up for it, if you even need it to be done, right?
Mhm.
Let's have you come back 3 months later. You don't have to make every decision. Let's just make the decision that gets you better first, right? We don't push anybody to do anything. I think that's the most important thing, right?
Yeah, that's a really refreshing thing because women can be really intimidated when they go into a plastic surgeon's office and you disrobe and you have a conversation about your body and you're so vulnerable and intimidated.
Yeah. Can I add one other thing in? I
Mhm.
think it's also really nice, like in our practice at Sculpt, we don't put in implants, right? We're not the surgeons that got you to this point, right? We're the ones that are there to help you. I'm not going to see like in one day, 2 women to remove their implants. And then in the afternoon, I'm going to see 2 women who I recommend implants to, right? That's just not what we do. So I think it's really nice to go to a trusted provider that puts their ethics where it counts. This isn't a doctor that is going to recommend a silicone implant to the next patient they see. We're literally there to just help you.
That's really refreshing. All right. Is there anything else that you think we should know about?
Yeah, I think that, to summarize the conversation, we all agree implants are on the way out, thank God. I think it's really important for women to know that things are changing. There are doctors and practices like us that are kind of ahead of the curve. There are people out there that are going to help you. There are doctors that you can come in to see that are going to believe your symptoms, believe in breast implant illness, and are actually looking for ways to get women better. And that you have a safe place with us. And so if it isn't with us, or if there's another local provider that's doing something similar, I think that with time, things are going to change for the better. And so I wanted to kind of end with like a positive point of hope, positivity. These conversations that we're having now are going to educate and inform, and it's going to get our message out. And I think as the years go on, things are just going to get better and better for women. And if you're feeling down, depressed, don't know where to turn to, there are definitely good people out there, such as you. There are amazing support groups now. Find those people that you can connect with, get good information. You're not alone.
Thank you so much. This has been such great information and it will really help women understand what a fat transfer is or why would they want to have this. So we really appreciate you joining us today. And can you just tell us, please, where people can find you so if they want to come in and consult with you about having this procedure done?
Okay, great. So I think the number one spot is to go to Instagram. We have a really easy tag name. It's @Sculpt. So that's spelled SQULPT. So sort of similar to this,
There you
@Sculpt.
go.
Cool.
Great.
Our website is www.sculptbody.com. Again, spelled with a Q, SQULPT body.com.
Okay.
That's the easiest 2 ways.
Thank you. Thank you so much.
Thank you for listening. Spread the word by subscribing, liking, and sharing the Killer Boobies podcast today. You could be the person who helps someone reverse their pain and suffering and reclaim their health today.